We've talked about keeping radiation exposure doses within the maximum permissible dose limits. How do we as dental radiographers know how much radiation we are receiving?
Well, a personnel monitoring device or film badge is one way to tell if you're receiving radiation. The film badge is a small plastic holder which contains radiographic film, or sometimes they have materials in them which can be radiated. It's clipped on to the individual's clothes, and generally we ask them to put them onto the upper part of the body so that the part that might be leaning too far into the room would be the part that would be irradiated. It measures the amount of radiation that you're receiving, and this is sent to the company. There are several companies which have them, and you send it to them on a periodic basis. Some of them are every month, and some are every 3 months, depending on the particular company. They give you a listing of how much radiation that you're receiving and how much you get on a cumulative basis. This is for a contracted fee, and usually they're pretty minimal. These reports should become part of the employee's permanent records so that you know how much radiation you've accumulated. It's important to know this information when you're trying to determine the maximum permissible dose guidelines for each of your operators. If you're receiving unnecessary radiation exposure, corrective radiation protection measures may be able to eliminate the radiation exposure.
Dr. Edmonds, are there any regulations regarding the use of radiation in our state?
Yes, Jim. We have representatives from the Department of Health and Environmental Control that help us by making sure that our equipment is up to standard. We have to meet minimum safety requirements, and we also have to make sure that the equipment is the proper type of equipment to use. They come out and inspect the equipment to make sure that it operates properly and that you've got everything that you need.